Hello everyone. I am myself Dr. Rajesh Gubba. I am the general medicine educator. So in this session, I'll be discussing a very important topic in the endocrinology, that is the complications related to the diabetes mellitus. So diabetes mellitus is one important disorder where there is hyperglycemia and insulin resistance. These two contributes to multiple complications. We have microvascular, macrovascular, and as well as the non-vascular complications. So the diabetes related complications, they are seen both in type 1 and as well as the type 2 diabetes mellitus. And in case of the type 1 diabetes mellitus, the microvascular complications, or you take in both of them, in diabetes, like you have micro and macrovascular complications, but for the development of the microvascular complications, there should be requirement of more than or equal to 20 years of the hyperglycemia, right? These microvascular complications, they include diabetic retinopathy, diabetic neuropathy, and as well as the diabetic nephropathy. So until the second decade of the hyperglycemia, the microvascular complications, they don't appear. And you take type 2 diabetes mellitus. Type 2 diabetes mellitus, majority of the time, they will be asymptomatic. So because they are being asymptomatic, the diagnosis of the type 2 diabetes mellitus, it is not in the early stages. Many individuals with type 2 diabetes mellitus have both glucose related complications or insulin resistance related complications. So in type 2 diabetes mellitus, the complications are because of the hyperglycemia and are because of the insulin resistance. So these two will contribute to the development of the complications. Whereas for the development of the microvascular complications, there should be minimum of 2 decades of the hyperglycemia. And you have to understand that this diabetic related complications, they can be prevented or they can be reduced with aggressive glycemic control, right? By aggressive control of the dyslipidemia, by aggressive control of the blood pressure. So by controlling these 3 parameters, the diabetic related complications can be prevented. And not only that, these diabetic related complications, they have to be detected early so that we can stop the progression of the diabetes related complications. And this diabetic related complications, as just now I was discussing, we classify them into the vascular complications and non-vascular complications. So this vascular and non-vascular complications are seen both in type 1 and as well as the type 2 diabetes mellitus, out of which you take the vascular complications. The vascular complications, we further classify them into the macrovascular complications and the microvascular complications. The macrovascular complications, they include the coronary artery disease, cerebrovascular accidents, and the peripheral arterial disease. So these are the macrovascular complications. Whereas if you observe the microvascular complications in diabetes mellitus, that includes diabetic neuropathy, then we have diabetic retinopathy, then lastly we have the diabetic nephropathy. So these are the microvascular complications, and for the development of microvascular complications, you require the development of hyperglycemia for at least 2 decades. And for the macrovascular complications to develop, the pathophysiological features, what is the reason? It is not just only hyperglycemia. Along with hyperglycemia, dyslipidemia, hypertension, long duration of diabetes mellitus. All these will contribute to the development of the macrovascular complications. Then followed by that, if you see the non-vascular complications, they are mainly the complications related to the eye, that is cataract, then glaucoma, then we have the changes within the skin, right? I'll be discussing this about these changes in the skin in detail, that is necrobiosis lipoidica diabeticorum, right, where you have the yellowish orange skin changes within the lower limbs. So that is your necrobiosis lipoidica diabeticorum. And another important skin changes will be the acanthosis nigricans. So this acanthosis nigricans is that where you have the presence of the dark velvety skin. So that is called acanthosis nigricans. And these individuals with diabetes, they have the avascular complication that is in the form of the hearing loss. And these patients, they have increased risk of dementia. And these patients, they also have the increased risk of cognitive impairment. Right, cognitive impairment. So these are the avascular or the non-vascular complications that you see in patients with the diabetes mellitus. And these non-vascular complications, apart from these, they also include increased risk of the infections, because this hyperglycemia will be acting as a very good source for the culture media for the growth of the organisms, and thereby the individual is prone for repeated infections. Now, let me tell you about the mechanism of these complications. So to summarize, the macrovascular complications will be like eye-related complications, that is diabetic retinopathy, both proliferative and non-proliferative diabetic retinopathy, and then the macular edema. And if you take diabetic neuropathy, the most common type of diabetic neuropathy will be the distal symmetrical sensory neuropathy, right, which I'll be discussing that in detail. Then we have the autonomic manifestations in the form of autonomic neuropathy. Subsequently followed by that, the another important microvascular complication will be diabetic nephropathy, where the individual will start presenting in the form of albuminuria and gradually declining renal function. So these will be microvascular. Then followed by that, macrovascular will be coronary artery disease, peripheral arterial disease, and the cerebrovascular accidents. What will be the other features? That includes gastrointestinal manifestations, that is in the form of gastroparesis or diarrhea. That is because of the diabetic autonomic neuropathy. They can present with either constipation or diarrhea. Genitourinary manifestations, mainly in case of males, the patient's presents with the erectile dysfunction, retrograde ejaculation. So that will be the sexual dysfunction that is due to diabetic autonomic neuropathy again. Then the dermatological complications like necrobiosis lipoidica diabeticorum and acanthosis nigricans, infections, cataract, glaucoma, diabetic chiropathy. So what do you understand by this diabetic chiropathy is where the patient will have a limited joint mobility, right, where the patient will have a limited joint mobility. Because of the limited joint mobility, like for example, if you take the joints of the hands, they will not be able to approximate both the hands together. So they will be able to place the hands in the distance, because of limited joint mobility. And once you correct the hyperglycemia, the limited joint mobility will get reduced and you get this classical prayer sign. So that is what is called diabetic chiropathy. Next, periodontal diseases. Candidal infections are very common in diabetics because they are like slightly immunocompromised, and then the hearing loss. So these are the avascular or non-vascular complications that you come across in patients with the diabetes mellitus.